Everyone knows we get energy from the food we eat and the drinks we have. What actually happens is that our body breaks down our food into tiny particles. These particles are called glucose, and this is a type of sugar. Glucose travels in our blood all around our bodies, so there is lots of glucose in our bodies just after we've had something to eat or drink. Our body also makes a chemical called insulin. Remember, this is glucose, this is insulin, and this is a cell. Cells are also very tiny and make up all living things, including plants and animals. 1,000,000 billion cells make up a whole person. Back to insulin. Insulin acts like a key for glucose to open up and get inside the busy cells in our body. Inside a cell, glucose is burnt to produce energy. When a person's body is unable to use glucose like this, they are said to have diabetes. There are different types of diabetes, but today we are only going to talk about type 1 diabetes. Someone with type 1 diabetes doesn't make enough insulin, or sometimes doesn't make any insulin at all. Type 1 diabetes usually shows itself before you finish primary school. You or one of your friends would know someone with this type of diabetes. In fact, about 6,000 children in Australia have it. Pretty common, isn't it? So what happens if there's no insulin to help the glucose get inside the cells and turn into energy? Well, it gets left in the bloodstream and builds up, and that gives us two problems. Firstly, what's the body going to make energy from? Because the body can't use glucose for energy, it finds other sources of fuel and burns these. But using other energy sources can cause a whole lot of other very serious problems. Our second problem is, where is all that extra glucose going to go? Too much unused glucose in the body can also lead to very serious problems. But the body is very clever and has a special way to lower the amount of extra glucose left in the body that can't be used to make energy. It gets carried out of your body in your wee. There are lots of things available to help people living with diabetes. This is lucky because we don't actually have a way to prevent people from getting type 1 diabetes. For a person with type 1 diabetes to stay well and healthy, they have to do two things every day. They have to check to see if their glucose levels have built up, are normal, or are too low by pricking their finger with a special little machine and testing a small drop of blood. And they also have to have 2 or more injections of insulin into their tummy to make up for their body's lack of insulin. These needles are only small and hardly hurt, and so the diabetic person can give the injection to themselves. Something else you might see students with diabetes doing is having a snack when it's not little lunch or big lunch. This is also to keep them safe and healthy by keeping their glucose levels normal. If you have a diabetic friend and they have a headache, feel dizzy, are hungry or sweaty, or are feeling faint, or have had a sudden change in mood, these are all signs that their glucose levels are low, and you should let your teacher know so they can help your friend. If your friend's glucose levels are high, you may notice that over the past few days they have become tired, have felt nauseous, weak, and thirsty, and it is very important that you tell your teacher about this straight away. Just before we go, we'd like your help to learn the signs that your diabetic friend is sick. Could you all stand up and act out each of the signs as they come up? Come on, up you get! Alright. Act out a headache, feeling dizzy, hungry, sweaty, a sudden change in mood, tired, nauseous, weak, thirsty. That was brilliant, everyone. Thanks very much. Bye!